I'd like to thank the panelists and Dr. Dietz for actually moderating this session, and thank our first two speakers as well, Dr. Durham and our patient speaker as well. My name is Deepak Kademani. I'm an oral and maxillofacial surgeon, and as was already mentioned, I'm speaking on behalf of the American Dental Association. And I'd like to, my charge for the next few minutes is to talk about the establishment of clinical pathways in terms of being able to define effective and clear algorithms of how we can manage our TMJ patients. As we've already heard from our patient speaker, there's lots of disparities and inconsistencies in how patients are diagnosed and therefore managed with temporomandibular joint disorders. As an oncologic surgeon, when I see a patient with a cancer, we have very well-defined clinical pathways in terms of how these patients should be preoperatively diagnosed, how they should be managed with surgery, and the need for post-operative adjuvant treatment. So any patient that's seen across the country will effectively get very comparable and similar care. And I think this is what we need to strive for in terms of management of TMJ disease. We also have to recognize that in order to deliver this high quality and consistent care delivery pathway to our patients, we need to ensure that pre-doctoral education, both in medicine and in dentistry, is actually optimized to teach TMJ. We need to also understand that postdoctoral programs, be they family medicine residencies, internal medicine programs, general practice residencies, and the whole other gamut of medical and dental specialties, need to be engaged in the education of TMJ care. I think for these pathways to be effective, it's really critical that we engage all of the stakeholders, both from the medical side and also the dental side, to be actively engaged in this, and really to try to emphasize that conservative management for TMJ is critical. There's only about 1% of patients that require surgical intervention when they have TMJ actual symptoms. If we think about the orthopedic model and the progression of osteoarthritis and organic joint disease, it's very well defined that when patients have progressive and symptomatic osteoarthritis, the total joint replacement early is completely appropriate to render patients the most functional and the most pain-free after the development of their arthritis. I think the challenges with TMJ disease really stem from a failure to diagnose and therefore to have effective management strategies, in particular for a distal disease and muscular problems, which in general, and in particularly for muscular problems that are not well managed with surgery. I'd like us to really think about developing perhaps centers of excellence. There are pockets in the country where we have very good expertise in the management of TMJ, and we have other areas too where we have a real lack of TMJ expertise in the medical and dental community. And I think that recognition of centers of excellence, trying to modulate and also emulate those types of programs would be key in broadening the healthcare delivery system of TMJ. So I think I'd like, in summary, just for us to think about how we develop interprofessional and interdisciplinary care pathways in TMJ, engaging all of the stakeholders that are going to be key in the patient care paradigm. We really need to focus and have an emphasis on TMJ in postdoctoral and pre-doctoral educational programs, both in medicine and in dentistry. We need to have some degree of recognition of kind of centers of excellence where patients can gain access to care. And all of this needs to happen in tandem with engaging the insurance companies, both on the medical and on the dental side, to ensure gaps and lapses of coverage don't occur. So I'll end my comments right there, and I want to thank you for allowing me to participate.